இளமையில் நாம் செய்ய நினைத்ததை முதுமையில் செய்ய இயலுமே என்று வாருங்கள் வாருங்கள் நண்பர்களே, கூடுங்கள் கேளுங்கள் நண்பர்களே. கோவைவானில் ஒன்றாய் கூடி சிந்திப்போம், கேட்போம், மகிழ்வோம். சிந்திப்போம், கேட்போம், மகிழ்வோம்.
This podcast is brought to you as a joint initiative between Anubhav, the National Institute of Social Defense, Ministry of Social Justice and Empowerment, and Media for Community Foundation. Project coordinators Dr. R. Sridhar and Alok Verma. Radio coordinators Pooja Murada, Kaushalya and Sai Sudha. Producers Covaicare Retirement Communities. If you are a senior citizen and need help, contact our Elder Helpline 14567 between 8 a.m. and 8 p.m. We promise to help you lead a better life. I repeat, 14567 between 8 a.m. and 8 p.m.
வணக்கம்.
Hello everyone, I'm Dr. Raji. I've been commissioned to give you a brief talk about some eye diseases. I'm an ophthalmologist in practice for roughly 25 years. So today I'm going to speak just very briefly about diabetic eye disease, glaucoma, and cataracts. So I'll start with diabetes, which as you all know is high sugar in the blood, and this high sugar leads to leaking blood vessels, not just in the eyes but also in the kidneys and in the feet. And because of this leakage in the blood vessels, this deprives the retina of oxygen, which can result in unhealthy growth of new blood vessels and swelling as well as bleeding and either temporary or permanent vision loss. The key to prevention of serious complications is tight blood sugar control, particularly the hemoglobin A1C level should be kept under 7.5 to the best of your ability, and at least annual eye exams. That's mandatory. Timely treatment with laser or intraocular injections of steroid or other medications can also prevent serious and permanent visual loss. So next we will move on to glaucoma, which, as many of you know, is high pressure within the eyes or intraocular pressure in the eye. Normal pressure in the human eye is between 10 and 20 millimeters of mercury. We measure it just as we measure high blood pressure. High IOP can cause loss of nerve fibers in the retina, and this unfortunately is progressive over time and irreversible. As humans, we start with roughly 1.5 million nerve fibers in the retina, which gather together like the wires in a large cable and connect to the brain to create vision. High IOP causes these to die. This is a painless and initially asymptomatic process. Eventually, this leads to patches of lost vision in the periphery, and very unfortunately, if it is untreated and uncontrolled, will eventually lead to blindness. And as I said before, the damage is irreversible. So, of course, annual eye exams are the key to early diagnosis and treatment. Treatment briefly consists of trying to lower the intraocular pressure. This can be achieved with medicine, usually in the form of drops, laser treatments, and sometimes in severe cases, surgery is necessary. The last topic is cataracts, which many of you may have experienced. Cataracts are the leading cause of preventable blindness in the world. It is generally a function of age, but the process can be accelerated by trauma, poor nutrition, certain diseases like diabetes, and excessive ultraviolet light exposure. It causes a painless and progressive loss of vision with glare, worsening night and color vision, and generalized blurring. A cataract is a cloudy lens of the eye. Your eye functions very much like a camera and has a lens inside. As we age, that lens becomes cloudier and harder, and this leads to defocusing of light. It eventually causes a decrease in vision, at which point we stop calling it a lens and we start calling it a cataract. Initially, changing the glasses prescription and a good pair of sunglasses will suffice, but eventually the only treatment is surgical removal of the cataract and placement of an intraocular lens implant. In general, for all of these and other diseases such as macular degeneration, people many times do not realize how important annual eye exams are, because many of the diseases which affect the eyes are often asymptomatic even until the late stages. And at that point, treatments are sometimes less successful than we would hope for. Whereas if you maintain a relationship with an eye physician and surgeon, the chances that you find these things early and treat them before they ever really even bother you, particularly the diabetic eye disease and the glaucoma, is the chances are very good. So I hope that all of you will establish or maintain a good relationship with an eye doctor and go for your regular visits, because seeing the eye doctor is not just about getting glasses. It's about much more important issues than that. So I hope you found this helpful. Thank you.
Thank you, Dr. Raji, for your very brief but informative talk on common eye disorders with particular reference to seniors. Dr. Rajalakshmi Mulukotla is an ophthalmologist in Middletown, Connecticut, and is affiliated with multiple hospitals in the area, including Hartford Hospital and Middlesex Hospital. She received her medical degree from Ohio State University College of Medicine and has been in practice for more than 20 years. She specializes in diagnosis and treatment of eye diseases, including vision loss, detached retinas, cataracts and glaucoma, laser retina surgery, refractive surgery, and lens replacement operations. Thanking you once again, Dr. Raji, on behalf of Covaicare. Here's Revati Bhaskar signing off till we meet again.
இந்த வலையொலி அனுபவ், தேசிய சமூக பாதுகாப்பு நிறுவனம், சமூக நீதி மற்றும் அதிகாரமளித்தல் அமைச்சகம் மற்றும் மீடியா ஃபார் கம்யூனிட்டி ஃபவுண்டேஷன் இவர்களின் கூட்டு முயற்சியாக உங்களிடம் கொண்டு வரப்பட்டது. திட்ட ஒருங்கிணைப்பாளர்கள் டாக்டர் ஆர் ஸ்ரீதர் மற்றும் ஆலோக் வர்மா அவர்கள். வானொலி ஒருங்கிணைப்பாளர்கள் பூஜா முராடா, கௌசல்யா மற்றும் சாய் சுதா அவர்கள். தயாரிப்பாளர்கள் கோவை வாணி, கோவைக்கேர் ரிட்டையர்மெண்ட் கம்யூனிட்டிஸ். நீங்கள் ஒரு மூத்த குடிமகனாக இருந்து உதவி தேவைப்பட்டால் எங்கள் எல்டர்லைன் ஹெல்ப் லைனை தொலைபேசி எண் 145667 இல் தொடர்பு கொள்ளவும். காலை 8 மணி முதல் இரவு 8 மணி வரை. ஒரு சிறந்த வாழ்க்கையை வாழ உங்களுக்கு உதவி செய்ய நாங்கள் உறுதி அளிக்கிறோம். மறுபடியும் கேளுங்கள். தொலைபேசி எண் 145667 காலை 8 மணி முதல் இரவு 8 மணி வரை.
That's all for today, folks. Be safe. Fight COVID with 2 vaccinations. Wear a mask when you go out. Keep safe distance. Observe proper hygiene. We must win. We will win. Thank you.